Dr. Quinn, thanks for joining us. What are some examples of some favorable side effects that you have seen in your practice?
I've seen a lot of favorable side effects of medications. And as I said, a lot of people, when they hear side effects, they think that it's something bad. But an example would be a medication. And when I did my training in Los Angeles, I actually worked with one of the young ladies that was involved in the research of this particular medication. Now, this medication, sildenafil, the other name for it is Viagra. It was initially developed with the protocol to decrease what's called pulmonary hypertension. But what they noticed was a lot of the patients that was taking the medication, the males, they would report a side effect that they were better able to function in their intimate relationships with their wife. And the word got out among everyone, and basically everybody wanted to get on that pulmonary hypertension medication. So with this positive side effect that was experienced by these patients, the pharmaceutical company, they got the clinical indication for erectile disorder, which was a side effect initially, but now it's a clinical indication, and it's one of the most popular medications that we write here at our clinic.
All right, Dr. Quinn, can you tell us about the new class of diabetic medication that is getting a lot of attention due to their side effects that patients are experiencing too?
Yes, this new class of medication, the GLP-1 agonist. This medication was initially developed for diabetes, and it got the FDA clinical indication for diabetes. But the deal is, a lot of people that were taking this medication, and there are two forms. You can get it in the form of an injection, or you can get it in the form of a pill. A lot of these people were saying, Doc, I'm losing a whole lot of weight. and I even had patients that come in and they'd say, I'm losing all this weight on this medicine, but I like it. I want to lose weight. And as a doctor, it's so great because if you have type 2 diabetes and you lose weight, for the majority of patients, the diabetes is better controlled and we can pull back on some of the other medicine. So this is a really exciting scenario, this GLP-1. The brand name is Ozempic. And the pill is Rybelsus, but that side effect is so favorable. And right now, the company is doing research to get the clinical indication for weight loss for different doses. But right now, already there's one that's been approved called Wegovy, which is a higher dose, 2.4, and it's being FDA prescribed, approved for weight loss with that positive side effect.
Dr. Quinn, speaking of scenarios, just reiterate once again, where a physician would change how they prescribe a medication if a side effect is considered beneficial?
Many scenarios. Like I said, with the GLP-1 agonist, we do that for our diabetics, but we also do it because we like that weight loss. There's a new one called Mounjaro, which is trizipatide. It has the GIP-1 and the GIP, two hormone medications that are in one shot, and people are losing weight with that. But the bottom line is side effects are not always a bad thing.
All right. Thank you so much for your time. Learned a lot of new information today. And that was Dr. Quinn with our Focus on Health.